Hello, I am Nadine Carty-Keynes, and thank you for joining us at the Nevis Emergency Operations Center, EOC, for an update on the situation regarding the novel coronavirus, COVID-19, in Nevis. I want to take this opportunity to welcome all the viewers out there and the media houses that have joined us virtually. All questions will be taken at the end of all presenters speaking. The Nevis COVID-19 briefing are aired on Mondays and Thursdays each week at 8 p.m. on Nevis Television. Or you can check them out at Facebook and YouTube pages, Nevis Television, Nevis HPU, or Nevis NDMD, which is Nevis Disaster Management Department. We have with us today the Honorable Mark Brantley, who is the Premier and Senior Minister of Health and Gender Affairs. We also have the Honorable Hazel Brandy Williams, who is the Junior Minister of Health and Gender Affairs. Mr. Brian Dyer, Nevis EOC Director and member of the Nevis COVID-19 Task Force. Mr. Lyndon David, Superintendent of Police, Nevis Division, and also a COVID-19 Task Force member. Dr. Judy Nisbet, who is the Chair of the COVID-19 Task Force here on Nevis. And we have with us Mrs. Vernice Blackett, dietitian at the Alexandra Hospital. And finally, we have Mr. Huey Sargent, Permanent Secretary in the Ministry of Agriculture et al. And COVID-19 Task Force member. I now welcome the Honorable Premier to give his updates and remarks.
Thank you very much, Nadine. And I express my thanks and gratitude, as always, to the COVID-19 task force, the local task force here, which has really been doing an amazing job in assisting us here in the island of Nevis and keeping us safe. My role today is brief. I wanted, of course, I come from time to time to show my solidarity and to show my commitment to this joint effort that we've all undertaken, and to thank, as I always do, those who are on the front line of this battle against COVID-19. I continue to urge our public not to relax, not to take the gains that we would have made for granted, that they continue to practice social distancing or physical distancing, that they continue to wear masks when out in public, and that they continue to adhere to the directions from our health professionals. The life that you save might be your own. It might be that of your loved one. And so even now, as we try to get the country back to some state of normalcy, we are still urging people to be sensible, to be disciplined, and to be responsible. We have been preaching about washing your hands with soap and water, using hand sanitizer, wearing a mask, coughing into your elbow, all of these things. Every little child now knows what we've been asking people to do. And so we're asking you to continue. And if you must not go out, if you don't need to go out, then please don't. Stay at home. That still is the best possible advice that we can give. The places that sell alcohol, the bars and all of those are still closed, should still be closed. And so we ought not to have people congregating at the bars. Restaurants will still only be serving takeaway. And so we're asking people to comply. The fundamental right, the most fundamental of all rights, is the right to life. And life is what we are seeking to protect. Property and everything else is replaceable. Your life is not. Insofar as the government is concerned, I have indicated publicly already that the cabinet would have met and the cabinet would have taken some decisions, including that we are in no rush to open the Nevis Island administration fully as yet. That will be done on a phased basis. And this morning I would have met with the permanent secretaries to discuss that further as to how we will open, to ensure that we maintain social distancing and we do not rush to reopen and get what is this dreaded second wave of contagion that many countries are saying that they're experiencing. So I would want to urge the public to be patient with us, because this is not something where we would want to undo the gains that we would have made. In addition, the cabinet would have decided that the ministers are taking a 10% pay cut for 3 months, and that again is to show some solidarity. I would want to thank the cabinet of ministers. It is, of course, a personal choice that they would have made, because let us remember that they are entitled to their salary, and they have decided to forego 10% for the next 3 months as a show of solidarity. In my case, I've decided to forego 100%, and that would have commenced on the last paycheck. So the idea is that we will do that for as long as we can, to sustain that for as long as we can. Again, symbolic, but intended to show solidarity with our people. We understand, and as a Premier of Nevis, I understand the difficulty that our people have endured, continue to endure, and I am, of course, saying to you that I understand, and that we, as the government, we also experience the pain. We understand, and we're trying our very best to empathize and to show you that we are in this together. I would, whilst I'm here, briefly take a moment to thank those who continue to come forward, those who continue to contribute from their own means and their own resources. I want to thank again our ministers. We have jointly decided that we will make $13,500 available from our personal resources each month to provide food for those who are most vulnerable. This to me is significant because it is important for us that no family in Nevis goes hungry, and we will seek to ensure that those funds are deployed for groceries for those who are most vulnerable in the community. Again, these are personal resources that are being deployed. Additionally, I would want to thank Four Seasons Resort Estates. They today delivered some 5,000 units of hand sanitizer. It is our intention, when we get to that point, to be able to distribute hand sanitizer, be able to distribute masks to every household on the island of Nevis, and we'll provide information on that shortly. Thank you. Thank all the workers. Thank all of those who have been out on the front lines, working with us, assisting us, and let me remind our Nevision people that we get back to normal quicker if you do what you're supposed to do. The sooner that you comply, and comply consistently, the sooner we can get our lives back to normal. And so with those few words, I want to thank everyone and, of course, urge the COVID-19 task force and the good people on the front lines to continue the excellent work that they've been doing. The country, the island owes you a debt of gratitude. Thank you.
Thank you, Honorable Premier, for your remarks and your words of encouragement. I'll now invite Dr. Judy Nisbet, who is the chair of the COVID-19 task force here on Nevis.
Good evening to everyone. As of today, April 23rd, we have tested on Nevis 85 persons and have received 60 negative test results, 4 positive test results, with 21 tests pending. To date, we have quarantined 213 persons, with 46 currently in quarantine and 167 released from quarantine thus far. 4 persons, which would be the persons who confirmed positive, are in isolation. All persons in isolation, all the cases, continue to do well. In an effort to control the spread of COVID-19 by interrupting human-to-human transmission, we have put public health and social measures in place, including lockdowns. However, we have periods when we loosen measures, such as we are having this week, for 4 days of this week. We ask persons to continue to practice social distancing, or should I say physical distancing, as they go out to conduct business, and to continue to wear masks in public places, to continue hand hygiene by washing hands frequently with soap and running water, or if not available, to use alcohol-based hand sanitizers containing 60 to 95% ethyl alcohol, cleaning frequently touched surfaces often, and keeping your hands out of your face. Now, you may say you have been hearing this over and over, but it is good to reiterate these measures. As we have said, it's a new normal that we have to get accustomed to. We have done much to educate persons about these public health measures. The Health Promotion Unit has produced a number of PSAs and has used all forms of media to get the message out. All that's left for you to do then is to practice these measures to curb the spread of SARS-CoV-2 virus. Now, the statutory rules and orders, number 14 of 2020, actually speaks to certain expectations of persons and businesses in terms of taking precautions. Example, wearing of masks in public places, physical distancing at work, reduced number of persons on ferries and buses, sanitizing places of work, sanitizing of hands, etc. To assist businesses and public transportation entities to adhere to the regulations, a compliance task force has been formed. I will allow Mr. Brian Dyer to speak in more detail about this compliance task force. Let us therefore continue to adhere to all rules and regulations. Thank you.
Thank you, Dr. Judy Nisbet, for your presentation and for your reminders of what we have to do to protect ourselves. And now invite Mr. Brian Dyer to give his remarks and to follow up on the compliance task force as mentioned by Dr. Judy Nisbet.
Good evening all. The Nevis Task Force has established the Nevis COVID-19 Compliance Task Force as of the 22nd of April 2020. The objective of this unit is to ensure the strict adherence to the regulations outlined in the SRO 14 of 20 and all subsequent SRNOs to follow the regulations that govern the limited operations of businesses during the days of relaxation of the curfew. Using the multi-agency approach, the agencies that comprise the task force are the Department of Environmental Health, the Royal St. Christopher Nevis Police Force, Customer Exercise, Department of Consumer Affairs, Department of Labor, Public Infrastructure, and the Fire and Rescue Services. The purpose of the Compliance Task Force is to ensure businesses and public transportation, that includes buses, ferries, and taxis, comply with the health and security measures outlined by the Government of St. Kitts and Nevis in accordance to SRNO 14 of 2020. Additionally, to act on the advice of the National Health Operations Center and the Nevis Emergency Operations Center to ensure the Federation remains safe and healthy place to live and to do business. And finally, in ending, the task force, the initial task of the task force is to provide some public education awareness to the general public so that the general public could be aware of what their roles would be going forward. The second week would be an assessment of the various businesses, and then after the assessment is completed, they will make recommendations, and following that explanation of the recommendations, what is required of each business places or the taxis and public transportation, then the enforcement aspect will take effect. So I want all in the business community to look out for these gentlemen, because they would come upon you at a moment's notice and do an assessment, make recommendations, and it is up to you, the entity, to ensure that you put the recommendation into practice. In ending now, I'd like to say a special thank you to Rene Busso and friends who provided the lunches and snacks for the emergency services on Monday 20th and today Thursday on the grounds of the EOC. I'd also like to say a special thank you to W's Restaurant who provided lunches on Tuesday 21st, and also Mr. Steve Tyson and Nelson Spring for a contribution of some water to the EOC. Also, Mr. Mark Freyon and the Four Seasons Homeowners Association for donating the hand sanitizers to be distributed to the general public in the near future. Thank you very much.
Thank you so much, Mr. Dyer, for your update, and thank you to all the persons who would have contributed to the COVID-19 response here on Nevis. I'll now welcome the Junior Minister of Health and Gender Affairs, the Honorable Hazel Randy Williams, who will give her remarks and updates.
Thank you, Madam Chair. A warm welcome to those listening or viewing today, wherever they may be. I trust that you and your families are safe during this very trying and challenging time in our country's history or in the history of the world. I have yet to find a single news station in the world that has not described the COVID-19 pandemic as something never before seen in our lifetime. An unseen enemy has literally stopped the flow of human life to which we have all grown accustomed. This virus that refuses to play second fiddle to anything or anyone has left few things untouched as it rapidly courses its way through populations the world over. Indeed, with just 14 cases in our country, and more specifically, only 4 in Nevis, of which there are 4 in Nevis, we are truly blessed. It is important to note that our good fortune and favor have not found us by chance. For months, dozens of people have been working non-stop, day and night, to maintain our nation's health and safety. Our healthcare professionals, the task force headed by Dr. Judy Nisbet, our doctors, nurses, or technicians, and these are just a few of the persons who are on the front line. They have all toiled tirelessly and relentlessly to keep us safe and to keep this virus at bay. I extend heartfelt thanks for their daily, selfless sacrifices of time, talent, and energy. The gravity of their responsibilities given to them is not something we should take lightly, nor should we ever take it for granted. Their tasks are, to say the least, monumental in nature, and without them, we would likely not be in the situation that we are in. And even though we are not in the situation that we want to be, having no cases, we are still in a very good position at this time. I would like to say at this time, the people of Cuba cannot go unmentioned. Our people and our country owe the doctors and nurses from Cuba an immense debt of gratitude for coming to bolster our healthcare ranks. Their willingness to assist has given us a welcome advantage in this fight. Even though Cuba is also currently battling COVID-19, its selflessness and care for its regional counterparts has no limits. We are blessed beyond measure and forever indebted to them. I would also like to thank profusely our local and federal COVID-19 task force. It is not easy to plan for the preservation of an entire nation. Nevertheless, the men and women to whom this Herculean task has been entrusted show up and show out every single day. They work, they plan, they assess this dynamic situation, which from all angles they have used to stay ahead of this microscopic invader, just to flatten the curve. I cannot neglect to make special mention of the members of the Royal St. Christopher and Nevis Police Force and the Defense Force. From the moment it was realized that COVID-19 was with us, these men and women have worked tirelessly in sun, dew, and sometimes rain to maintain law and order and to ensure that our people's physical health in this global fight. Nevisians, we must remember that the battle against COVID-19 cannot be won for you. It can only be won with you. Hence, we must all do our part to fight against the spread of this disease if we want to emerge triumphant whenever this pandemic ends. This is why we in the Ministry of Health continue to urge you to follow the safety briefings and the do's and don'ts. And I think we would have heard them over and over again, but it is worth repeating until everybody gets it right. Do wash your hands thoroughly. Soap, water, sanitizers if you have. Don't touch your face. Do practice social distancing. Don't forget to sanitize your phones and your shoes when you get home. Do keep a bottle of hand sanitizer with you at all times. Do practice cough and sneeze etiquette. Don't shake hands. And so we are a community of shaking hands and hugging, but for now, we have to cease doing all these things. The Nevis Island Administration is currently improving its anti-COVID-19 plan. Day after day, the team come together and they seek to come up with plans to see how best we can combat this pandemic. This is why we recently partnered with Newfields Technology for the development of a mobile app. This app aims to put in our palm information on what we are doing and what we can do to further protect ourselves. And we have heard several appeals for persons to go online and sign up for this app. It is user-friendly. It is very easy. Once you you follow the instructions, it is very easy to upload your information. The purpose of this app is to assess the health of Nevis' residents in order to help the Ministry of Health properly plan a response for any future health-related situations and/or future outbreaks. But most importantly, it is for now. For the duration of the COVID-19 pandemic, this app will be used to manage and track active COVID-19 cases and serve as an avenue through which users could be provided with medical assistance should they need it. So I'm appealing to the general public to go online, and I think the Madam Chair would be able to give you again to remind you of the site, how you can access the site, and feel free. We are begging you to go online and sign up so that we can have that information readily available now and for the future. I will encourage all residents to go, as I said before, and download the app. Do not hesitate to sign up. Knowledge, information, knowledge and information. More knowledge, more information saves lives. This is the very foundation upon which this app was created. It was created for all of us. So among other things, this app gives hope to this country of ours. The more we know, the better we can plan, prepare, and protect. And that is what our team is doing now. We are planning, we are preparing, and we are trying to protect all of our citizens. So kindly make it easy for them and sign up as soon as possible. To all those who are working assiduously to keep our little island and its residents safe, I again extend heartfelt thanks. I cannot reiterate the fact that these persons, starting from the task force and going down to all the other technicians, they have been working from day one, from get-go, to keep our island safe. And so I would want to continue to reiterate our thanks, our heartfelt thanks from the Nevis Island Administration, and from my own personal behalf, I would like to continue to thank them for the work that they have been doing. I know that these are very trying times and there are difficult situations financially, spiritually, and mentally. And so I would want to say to all of us that we are in this thing together. And together we will conquer. We will win this war against COVID-19, but we have to work together. It has not been easy for many of us, and so I'm asking you, each one help one. Neighbors, check on our neighbors, especially those who are elderly. Check on those who are living by themselves on a daily basis as we continue to fight COVID-19. Once again, thank you very much and keep up the good works. Thank you one and all for all your contributions and what you have been doing in the fight of COVID-19. Thank you.
Thank you, Honorable Hazel Brandy Williams, for your sound words and your words of encouragement and support. And I'd like to welcome the Superintendent of Police, Nevis Division, Mr. Lyndon Davids, to give his updates on the COVID-19 response.
Thank you very much, Nadine. Good day all. It's a pleasure to be back to let you know how things are going thus far from law enforcement perspective in support of protecting the island of Nevis and by extension the Federation from the spread of COVID-19. Thus far we have had 383 patrols, 35 vehicular checkpoints, 10 arrests for curfew breaches, and out of that we have had 4 persons already being charged and bailed. During the curfew, we realized that persons are still out there committing crime. So we had 4 reported crimes, and out of those crimes, we had 3 persons who were arrested. 600 vehicles stopped, and of the 600 vehicles stopped, we realized that the majority of the persons are essential workers, and I want to congratulate them for cooperating with the security forces as they're out there ensuring that they are safe. We had 8 persons who were informed that there will be summoned for breaching the curfew. I must say at this time that we have attention being placed on bus drivers for the week thus far, and we realized that in most part they were complying with the number of passengers they were permitted to carry, and also persons should be wearing masks and they're being sanitized while they're in the vehicle. Just reminding the general public and all to continue to wear your mask in public spaces and ensuring that you continue with the social distancing and social and physical distancing whilst we are out there doing our various undertakings. Liquor license premises, we just want to remind you, stay closed, stay closed. We are taking at this time to allow persons to inform the police or inform the person, look man, you should be closed. Why are you opening and sort of encouraging the spread of the virus? So persons, stop it. We come and meet you. We're going to summons you. I just want to let you know, under the Act, you can face a fine up to $5,000, 6 months in prison, or both can be applied. But most importantly, your goods or money that will use in connection with the offense can be forfeited. And we will forfeit them. If you do not have use for them, well, when we get them from you, they can be discarded or they can be used elsewhere to assist the country or the island of Nevis. Persons who have their permits to be on the road during the curfew times, we realize that most of you are being out there when you're supposed to be out there, not abusing the privilege that you have, and we want to thank you for that. So at this time, In closing, I want to thank God for his continued mercy upon the Federation of St. Kitts and Nevis. We know that we see what the evidence has shown, and we are hopeful and prayerful that he will continue to let us have good results. The governments, both federal and island administration, the staff of the Royal St. Kitts and Nevis Police Force and the St. Kitts and Nevis Defense Force, the medical staff, disaster department staff, all other essential workers who are out there to ensure that the island continue to run the way we want it to run, so that we can have things going well for us. There are a number of citizens who came forward and assist us. We want to thank you for the role that you have played in order to ensure that we continue to do what we have to do. And you violators, we realize that you continue to challenge us, but we are saying to you, be a part of the process to protect the island and by extension the Federation. So remember, it starts with you and your family to keep us safe. Thank you very much.
Thank you, Superintendent David, for your updates and your encouragement, and also for your little blessing at the end. Thank you. I'd now like to welcome Mrs. Vernice Blackett, who is the dietitian at the Alexandra Hospital, who will provide some information regarding nutrition at this time during COVID-19 especially. Mrs. Blackett.
Good evening, everyone. It's really good to be here this evening to help us nutritionally through COVID-19. Now, we are fearfully and wonderfully made, and our Creator wants us to be in good health and to prosper. And so, He created some foods that we really should eat. There are some very important ones that I want to stress on, especially as we need our nutrients to help us to fight COVID-19. Now, there are several food groups that are in the food list, and I want to concentrate right now on vegetables. We tend not to want to eat much of these because of the taste. Some persons say they just don't taste good. Some persons call them bush, grass, animal foods, but they're very good for us. If they're good for the animals, they are even better for us. So I would like to encourage all of us to eat more of these food items in the vegetable food group. Now, we get our vitamins and minerals from this food group and also the food groups. Okay? Some of these may not be in season, but I realized the other day that a lot of cherries, which are rich in vitamin C, are in season. And so I would encourage you, and we do have some soursop, even though the monkeys may go with some of them. And of course, we would get some citrus fruits from the supermarket and from our local suppliers. So concentrate on eating a lot of fruits and vegetables so that we'll be able to get our vitamin C's and other nutrients that are necessary to keep us healthy. Now, we tend to go to sleep with our stomachs full. I would like to discourage you from doing that. We really should eat 2 hours before we go to sleep, because we usually hear that we need lots of rest so that we are able to be healthier and fight infection. Now, it's better to eat your heaviest meal for breakfast. Breakfast should be your heaviest meal, a lighter meal for lunch, and a very small meal or light meal for supper. Now, once you go to sleep with your stomach more or less partly empty, you're better able to rest. Now, we need rest for us to be healthy. You may think that you got a good sleep when you go to sleep, but really and truly your stomach is so busy working to digest the food that you would have just eaten that you really did not get enough rest. So I would like to encourage us, eat less before we go to sleep. Now, we need lots of water. our bodies need hydrating. And if our bodies don't have enough water, then we would get sick more easily. So, hydrate your body each day. You may ask how much water you need. It all depends. It depends on your activities during the day. Some persons say 8 glasses. It depends on the weather. You may need less. Depends on your activities. Construction workers may need more. So it all depends on your age group, your activities of the day. Now, sleep. How many hours of sleep do we need? Some persons may say 8 hours, but it all depends also on your activities of the day. If you are well rested during the night, then you would be healthier. Exercise. Do we exercise enough? Some persons may say, well, because of the curfew, we are not able to exercise as we should. But you really can. You may not be able to go on the road, but you can exercise in your bedroom, on your porch, in your backyard. So don't forfeit exercising because of the curfew that you figure may be keeping you back. Continue to do as we are instructed to do, and continue to stay healthy. Thank you.
Thank you, Mrs. Blackett, for your words in regards to nutrition, physical exercise, and sleep, key things that we need to stay healthy. Mr. Huey Sargent, Permanent Secretary in the Ministry of Agriculture et al., will bring his updates.
Good afternoon, all. I want to continue to thank our farmers and fishers for their very hard work during this time. And I'm particularly pleased that I get to come after the nutritionist who spoke about the wonderful fruits and vegetables that we must consume. And I'll take the opportunity now to let you know that we have tomatoes, cucumbers, sweet potatoes, yams, cassava, banana, ripe and green, cucumber, and eggplant. These are all in season right now. And you can patronize your local farmers and vendors across the island because, as the nutritionist said, these are the best things to eat at this time, and we at the Ministry of Agriculture continue to work hard to make sure we have food security on the island. And in that vein, we are asking members of the general public to give us a chance. We realize that we've been overwhelmed lately. Apparently, everybody seems to be a farmer these days, and the government made some wonderful incentives available, and suddenly we find ourselves running all across the island trying to prepare lands and everything for persons. Our equipment is finite. We only have a certain amount of tractors and implements and so on. So we ask you to give us a chance. We'll get to you, but please do continue to call. We enjoy this enthusiasm, and we trust that when we assist you, you can further assist the members of our general public. And finally, we have our abattoir and agro-processing units that are open. They continue to supply local meats and agro-processed items that are also healthy for consumption. So they're opened on relaxed curfew days from 8 to 12 in the case of the agro-processing unit, and from 8 to 1 in the case of the abattoir. We continue to encourage everyone to practice physical and social distancing, good and proper hygiene, and to make sure that you stay safe. We're all in this together. Thank you.
Mr. Sargent, thank you for your update in regards to what the Agriculture Department and the Ministry is doing. And I'll take the opportunity to field some questions from our media houses. First question is from Vaughan Radio Newsline, Shamika Budgin. What do you have in place for price gouging? I know that the authorities as well as the Premier have warned businesses to cease and desist from this act. but this is still occurring in some of our major supermarkets. Is there a penalty in place for business owners if they do not comply, or what will be the next step to protect or safeguard shoppers?
Thank you very much for that question. I will answer it from this point of view. In our current regulation, Regulation 14, Emergency Powers COVID-19 number 5, and when we look at Regulation 18, it speaks to our compliance task force. And as was mentioned earlier by Mr. Dyer, that task force will be tasked to go out and ensure that there is compliance. Now, on the team, we had someone from the consumer affairs who will ensure that prices remain the way they are to remain, and if any hiking, well then you know that whatever the inspector and the team decides, well, that person have to pay. But we're encouraging persons, do not let it reach that way, so you know, have heard, and we prefer that you start to comply at this time. Thank you very much.
Thank you, Superintendent David.
Good afternoon.
Good afternoon.
Monique Washington, St. Kitts Nevis Observer newspaper. Premier spoke about not being in a rush to open the NIA. If you're not in a rush to open it, that means that you will have less revenue coming in. So my question is, will the government still be able to pay their debts and also pay salaries for those persons that are still working?
Thank you, Monique. The Honorable will attempt to answer on behalf of.
Thank you, Ms. Washington, for your question. I am not the Premier, but I will try to answer as best I could. In the Premier's presentation, he did say that we are not in any rush to reopen government proper. I think what he means is that we are not in any rush to open government full throttle, but there will be some essential departments, especially those revenue collecting departments, that would be expected to be reopened gradually, but on a lower, smaller scale staff. But they are the ones who we will start to reopen first, gradually, before we go full-fledged into reopening the entire NIA. And that is because we are still hoping to exercise the social distancing, but as you rightly say, there is the need for us to collect revenue. And so we have to start by opening those revenue collecting centers with smaller staff numbers on maybe a rotation basis, but those are the ones who will be open first. In terms of government being able to pay its make good its commitment, it is a work in progress. We know it's going to be a difficult time, but if we are to collect and if persons are to still maintain their social responsibility, that of paying their taxes, I am certain that we will be able to at least pay some of the commitments that we have to. Thank you.
My next question is to Mr. Sargent, and it's just basically an update on the farmers market. I know they were doing like a rotation of the farmers market in different locations. Is that still going to happen, or what will become of that?
Thank you, Ms. Washington. We certainly would like to continue our farmers market initiative. Currently, because of our social and the physical distancing protocols, we are opting now to distribute the produce, and the farmers likewise are opting to distribute their produce to supermarkets and our roadside vendors. So yes, the food is still available. However, we're trying not to have any large gatherings, as we realize the farmers market tend to do. Thank you.
Thank you, Ms. Washington. Any further questions? Vaughn, are you there? Mr. Brown of Vaughn Radio. The Premier mentioned in his address yesterday that the NIA will have to forego some capital projects to bolster food security. In that regard, could PS Agriculture, Mr. Sargent, speak to what plans or prospective plans the Ministry of Agriculture are looking at?
In terms of food security, what we are looking at, that I must remind you, I must say that the plans are currently still being developed. We are seeking firstly to make a lot of our farms more efficient. We've allocated quite a bit of land in the past to crop production and livestock production. We have situations where maybe less than 50% of the lands that have been allocated are not being used as efficiently as we would like. So our first aim is to really get the land allocated to be more efficient. For example, in livestock production, we have a situation as well where we have farmers who simply open their gates in the morning, their animals roam all day, and the animals come back in the evening. They're quite nice animals, actually. And we tend to discourage that type of farming as well, because after a couple of months we realize the quality of the meat is not something that we like. So we're encouraging farmers in terms of livestock to cut and carry, cut as much feed as possible, take them to your animals. That way we have better quality in terms of the meats being produced. Crops, again, we have looked at quite a number of short-term crops that we can get from anywhere between 6 weeks and 3 months. Those are the crops that we are focusing on for the next 6 months at least, so that we can ensure that there is some level of food security in the short term. In the medium term, we'll be putting some more plans in place. For example, food storage is an issue here on Nevis. When we have an overproduction, sometimes we are not able to store the food. So that too is an issue that we're working on. But as I said, the plans are still being developed. We'll be sure to advise you accordingly. Thank you.
Shamika Bajin, Von Radio. As we are continuing the fight the COVID-19 pandemic, how prepared is the Nevis Disaster Management Department for the upcoming hurricane season, as we have roughly 5 to 6 weeks before it begins?
Thank you for that question. The Nevis Disaster Management has maintained its policy of managing multiple hazards, and in that regard we have maintained our preparatory actions with regards to hurricane seasons. We have a number of volunteers in our communities, and we have begun our annual inspection of the emergency shelters. However, the emergency shelters would be looked at with regards to the spacing and the physical distancing requirements, as we will have to reduce the number of the occupancy in some of the shelters. We are also in the process of installing generators at most of our youth facilities. We have identified 6 shelters that will be equipped with generators for the upcoming hurricane season. We are in the process also, or we began the process of updating our disaster plan, but that had to be shelved because of the pressing issue of the COVID-19. So we will continue to update our disaster plan and ensure that the legal department would have a chance to review it before it becomes final. But all in all, we about 80% ready for the upcoming hurricane season. We continue to do our public awareness campaigns. That's a significant part of our preparatory actions as well. So we should be ready by next 5 weeks. Thank you.
Thank you, Mr. Dyer. Vaughn Radio. Can we have somewhat of a situation report, if it has not been done already, like how the confirmed cases are doing, etc.? Dr. Judy Nisbet.
Thank you, Ms. Budgeon. As I would have said in the first part of the show, as of today, April 23rd, we have tested 85 persons and we have received 64 tests. 60 of these are negative, 4 are positive, and we currently have 21 tests pending. We have currently 46 persons in quarantine, and we have released 167 persons from quarantine. Now, the persons who are tested positive are doing well. They currently have no symptoms, and we are looking forward to releasing them from isolation as soon as we are able to. So they're doing quite well. Thank you.
Thank you, Dr. Nisbet. Are there any more questions? Okay, I want to thank all the media persons for their questions asked. And I also want to take the opportunity to remind persons to obey the instructions, the rules of the state of emergency, and also to remember to be safe by protecting yourself and others, by washing your hands often with soap and water. Cover your cough and sneeze with a tissue, or you can use flex elbow. If you use a tissue, discard immediately in a closed bin and wash hands. Avoid touching your eyes, nose, and mouth with unclean hands. Disinfect touch surfaces and areas often. Eat fruits, vegetables, drink water, and exercise often to keep your body strong. Practice physical distancing always. Every time you're out and about, please practice physical distancing. Wear a mask or facial covering when you're out. It is not a substitute for physical distancing. They both go hand in hand. Wear your mask, keep physical distancing, and stay at home if you must. Our hotline numbers are 311 or 661-5051. And I want to also encourage persons to sign up for the Nevis Health app, where you can self-monitor your health during the COVID-19 crisis at kn.unhin.org, or you can simply use your smartphone and scan the barcode that is seen on the television. Together, we can fight COVID-19 by using this tool, in addition to everything else that we're doing. I want to additionally put a plug in to thank the Nevis Disaster Management, Caribbean Digital Display Limited, Cornerstone, and Nevis Television for making these briefings possible. I am Nadine Carty-Keynes. Please join us again on Monday, 27th April at 8 p.m. for another Nevis EOC briefing on Nevis Television. Thank you for viewing.